Good afternoon, everyone. Thank you for joining. My name is Mary Gage. I am the digital marketing specialist at Enterprise Health. I wanted to welcome you all to today's 30-minute webinar on randomized testing programs. We appreciate everyone's time today. We know you all are busy, which is why these webinars are designed to be fast and focused on a single topic, in most cases emphasizing a new or innovative functionality developed to support occupational and employee health operations of our clients. Our intent is not to sell any of these capabilities on a standalone basis, but rather to share innovative components of the total enterprise health solution developed in collaboration with our client community. Today's webinar is focused on how Enterprise Health simplifies the management of random drug and alcohol testing. During today's webinar, we're going to show you how Enterprise Health simplifies enrollment of employees in a drug testing panel, randomly selects employees, helps meet current DOT agency testing requirements, creates orders, notifies the correct contact to perform testing, tracks employee compliance, and streamlines reporting. Today's presenter is Dave Cornwell. Dave is our Director of R&D and is responsible for overseeing the continuous innovation of our solution. So I will now turn it over to Dave.
All right. I thought I'd start off with this. The reason we made this tool is for government regulation. These are the percentages that they require. If you have employees that belong to these groups, these are the percentages of the people that you have to randomly select from. So that is why we made this. We have a few different scenarios that we're going to cover. We have the simple one that if you have a group of employees and then amongst your employees, you have a smaller group of employees that belong to one of those groups, or maybe many of those groups. You may have multiple circles for the need randomly tested that we're going to be able to randomly select from those. It's just simple single employer. We can also handle a scenario where if you manage this program for multiple companies, so you would have more than one employer, and then within each of those employers, you then have that group of people that needs to be randomly selected for testing. The tool works pretty much the same. It's going to be just ran against the employees for company one, and you'd run it against the people that need tested, and then you would run it separately for the employees in company two. So still pretty similar. And then the third one, saved the funnest for last. If you are managing this program for a group of small companies, so if you have some smaller companies, maybe they only have five drivers they're in their employee. Not really great to pick 50% of those people once a year. That's not very many people. So if you want to group those small employers together, you can combine them and kind of roll them up into sort of a pseudo parent organization. And then we will run the tool against that parent organization, and it will treat all of these sub-employers as if it's their own, and it will just randomly pick from a pooled group of people from across all of those employees. A few things that we have to have set up in order for this to work. There's a health surveillance panel. So this is the normal health surveillance panel that we would use if you're running a different kind of monitoring program, an OSHA noise or whatnot. The big difference here is that these procedures are marked as just on demand. And so that health surveillance processing that normally happens on most of our panels, these are sort of ignored. It's on demand. It doesn't happen once a year. The tool is referencing this to understand, now that I've chosen someone, what procedures need done according to the panel that I've defined. We also have to have the concept of an employer organization in our system. That is a chart. And then that defines this is the name of the employer, and then we group all of the employees that belong to that employer, and then of course identify them as belonging to the panel so that we get that smaller circle of needing to be randomly chosen from. And then there's a couple of chart tabs under that employer organization. We have a tab for the random drug tester, which I'll be showing, and then a report. So on that health surveillance panel, I've created a simple one here. This is for the .FEMSA, and it has the breath alcohol and the DOT urine. And as I said, they're marked as on demand. And then you have your employer with people to test. I've used our sample employer Better Corp that comes with our demo system. I put all 11 employees of that employer, put them all into my drug screening. so that we can choose from a larger group. Didn't have a lot of numbers. So now, yeah, we get into the fun part. This is the tool. Now that we have all that configuration, this is what brings it together. We have that random drug screen tester tab that I mentioned that was added to my employer organization now. And so when I come in here, I see that I have a drug screen group. So this drop down comes from that health surveillance panel. I only have the one for this demonstration. If you were managing multiple multiple programs for this employer, you would see multiple in this drop down. Likewise, if you're managing multiple programs across multiple employers, this drop-down would be limited to the programs that this employer has employees enrolled in. So if this employer only has drivers, we'd only see the program for the drivers. And if another employer has, let's say, only pilots or something, you would only see that in the drop-down for them. So it's not going to be showing you programs that do not pertain to this particular employer. And then, of course, it shows the orders that we're going to need to have done. We have our urine and our breath alcohol. Now, just to start this off, I just came in here and I hit search without setting anything up. This was there by default because I only had one, and I hit search just to see that my population here is listed. I wanted to just check my total number, everyone that's in the pool for this employer. You know, very useful, I guess, for the start of the program if you're getting the employees defined in this group, you know, say over an HR interface or something. Just want to make sure that you're getting the right number of people in that group to start off with. And so now that I verified, yes, this is the drug pool I was expecting, I can go ahead and start actually randomly selecting for people. So I have my main percentage here that I need to have 50% that I need to choose. And so that's going to be 50% for that DOT urine. And so that's searching for half of the population. I only did this one time per year because we have some small numbers. The times per year can be done with different ranges. We can do it twice, 3, 4 times, or even 12 times a year if you want to run this every single month. That'll do the math for you. It'll take your 50% and just divide that by the number of times a year. If you're going to do it every month, it'll take that number, divide it by 12. And then, of course, in an ideal world, you would be testing the divided by 12 number, you know, randomly select that 12 different times and add up to your 50% in the end. We also have a 10 in this box here. It is kind of off to the side. For this breath alcohol, we only need to do 10%. And we want that to be of the people I found for my 50%, I want to have 10% of the people get that second order. And so you'll see here that everyone got the DOT urine, but only the one person got a breath alcohol. So we've only got 10% of that getting that. We do have an option for skipping anyone that was drawn last time. This was something that came up on certain scenarios. They didn't want someone that had the testing done last month to get it again this month, so that is an option. Once I've confirmed that, yep, okay, everything looks good, we can click the little check all. It highlights everyone, and we can add it to their do list. And this just basically goes out and adds these orders to their do list to indicate these people have been randomly selected to be tested. And we'll go to our drug report tab. So this is the tab to review who has been selected, and it is both useful for right after you do the selection, you can come in here and see everyone that just had those orders created. I can see my list. I can look at who their supervisor is, their clinic location, their work location. We have several fields in here to help assist you in grouping all of these people into who needs to be notified. I think we've heard a couple of different scenarios that we want to let their supervisor know that they've been selected so they can let them know where they need to report. There's someone at the building that handles all of this, so we want to just sort by that building and send everyone for this building, that building, and that building. We have a contact for them, so we'll send the list to them. So we have several columns in here to help assist in reporting on who needs to get notified. It's also useful for managing it. If you're doing this every month and you need to make sure that in the next 30 days these people need to get in and get tested, so you can come in and filter on that date range for what has been ordered in the last month. And make sure that they are in fact getting those done. It's off to the side here ahead of a small screenshot, but there is a status column over here where you can check to see if that order has been completed or if it is still pending. And I believe, I have one more screen of this. This is grouping by the work location. So just to show the ability of, like I said, I want to sort this by one of these fields to indicate everybody at Better Court main campus. I need to send that list off to the contact for that area. But these can, of course, be grouped by any one of these fields that makes sense for your use case.